the world as revealed by Devi Parashakti.
Yes, as Devi has revealed that because of the so many traitors and conspirators, which they did so much of destruction to the cosmos, the pralaya is happening now. And she mentioned about the India, where the lives will be lost, not only in thousands, not only in lakhs, it's going to be a crores and crores of lives will be lost in a few months. What Devi has revealed and what is happening now, we're going to see in this segment as in line to the Devi's Parashakti's revelations. The World Health Organization, it says the Omicron is not a normal, it can kill also. The World Health Organization (WHO) has released a new warnings on the Omicron. The World Health Organization has warned that this type of virus will not cause much harm as the world recover from the effect of the corona. The Omicron virus has spread to various countries, creating the risk of gentle outbreak again. The virus, which was discovered in the South Africa a few weeks ago, has spread rapidly and posed a major threat to the rest of the world. As we all know, this Omicron variant, which was found in South Africa a few weeks ago, now it is in the place of almost more than 100 countries current days now. And it is causing and it is spreading in a multiple fast manner than whatever the pandemic which faced globally maybe like 2 years before. So this Omicron variant, why it is so special and what is happening now, we're going to see more details in this. As Devi has revealed, especially about the India. Now the India reports 2.71 lakh fresh COVID-19 cases. In this, the Omicron cases now at 7,743. It is in last 24 hours itself. The COVID-19 cases to 371, 22, 164, including the 773 cases of Omicron variant, according to the Union Health Ministry data updated on the Sunday. The country saw 1,702 new cases of Omicron variant, the highest of the single day so far, an increase of 28.17% since Saturday. So what we have recorded on Saturday and what they have recorded in Sunday, the last one day there was a spike of 28.17%. We can see the graph, we can able to get what is happening in the India specifically. The starting of this new year, where the cases was in thousands and moved to few thousands. Last 4 days before, it was 98,000. Now it is double, not than double, it's tripled almost to 2.7 on fresh cases, the new cases which have been identified in last 24 hours itself. So according to the experts, it is not possible to undertake genome sequencing of each and every sample, but stress that this wave is largely being driven by the Omicron. So as we all know, the last pandemic also we faced so much of lack in the hospitalizations. The beds was running out, they were running out of oxygen. Now here they're facing the new struggle of having the test samples, and because they couldn't able to do they, but the assumption they were stressed that this wave is largely being driven by the Omicron. The active cases have been increased to 15,50,000, the highest in the last 225 days, while the death toll has climbed to 4,86,000 with 314 plus fatalities. Last 1 year, what is the amount of cases, the higher number of cases which have identified in India, now this speaking up now. Government officials have privately said that they are working under the assumption that the daily infections will surpass the record of more than 4,14,000 set in May. So these are assumptions, this is a prediction from the government officials. They said, as of now, the cases are in around 2.71 lakh fresh cases every day. But they predict at the end of May, it may lead to 4,14,000 fresh cases every day. Given what has happened in the country, such as the United States, where daily cases recently rise up to 1 million. Is it the same variant as we seen the previous articles, previous records? It says this Omicron is the one of the variant from the COVID-19. The third wave, the third variant from the Delta. But this study, the virologist says, probably two pandemic going on side by side. This they found out. They're saying that this Omicron is completely a new virology. There is no parent or mother from which the COVID-19 have came. The scientists are exploring whether the Omicron is the different pandemic altogether. Virologist and former chief of India Council of Medical Research, Dr. T. Jacob John, said it is a very likely that two pandemics are going on side by side, one by the Delta and other by the Omicron. As we all know, this Delta variant has not went out of the world now. It is still there. It is making more and more pandemic all across the globe. Providing some fresh insights into the origin of the Omicron, the virologist told news agency that Omicron is not fathered or mothered by Wuhan, which is the parent and mother for the alpha, beta, gamma, delta, kappa, and mu. That was all the mutations which were formed from the COVID-19. This state said this Omicron is not a father, is not fathered or mothered by the same Wuhan. According to the Dr. Jacob, Omicron immediately parentage is not known, but it has some distinct connection with the Wuhan virus, which began the pandemic. They're saying some connections are there, but it is not parented or mothered by the same Wuhan virus. Since Omicron is the intelligent or deviant from the COVID-19 pandemic progressive scripts, we must think of two pandemics going on side by side. Delta and close relatives on Omicron, that is the variant in the future. So these are the news which is cropping up in India current now, which is Telangana government has extended a holiday for education institutes till the Jan 30. The state cabinet met on Jan 17, which was decided that they're going to announce the leave for all the schools and colleges and all the education institutes all across the Telangana district. The Gujarat Post, however, almost 12 people COVID positive rate, 12% COVID positive rate. Ahmedabad, one of the busiest city in the India, posts highest number of cases. The COVID-19 cases in the Polborn Manipur continues to rise positivity rate up to 7.1% from 4.1%. So what will be the solution? What is the government is taking now, the remedy steps in India? Is there going to be a nationwide lockdown in India and rising COVID-19 cases from the expert? So what is one of the steps which was taken by the government in the last pandemic, which is happening now, we're continuing also to control the spread of Omicron, is lockdown. So is the India is going to have a same lockdown strategy this time also? So since this Omicron variant of the COVID-19 continues to wreak havoc across the India, with the country reporting 271,000 new cases in the last 24 hours, just 20 days in the third wave of coronavirus, which has started on December 27 last year. Several state governments are already trying to brace against the deadly virus by imposing the various restrictions like shutting down schools and college, nightclubs, and weekend lockdowns. We all know this. Many of the governments, Tamil Nadu, Karnataka, Andhra, even Kerala, many of the government already imposed the lockdown. So they are going to be assumed a nationwide lockdown in India. So why it is happening? What is the reason for this so much of spread? In the last case, we are able to track the cause of the virus, from whom it is spreading to whom and it is spreading. We can able to track their record. But this new Omicron variant, the study found provided evidence that this Omicron variant is a community transmissions. There are a study in the Delhi COVID samples between November 25th and the December 23rd last year has indicated that there was an eventually community spread of the Omicron in the capital. The capital city of Delhi, the health minister Satyendra Jain already claimed that Omicron was spreading in the community as the people without any travel history were getting positive for Omicron, the variant which have caused a surge in the COVID-19 cases in India. However, the report by the Department of Clinical Virology, Institute of Liver and Biology Science, New Delhi, is the first report confirming community transmission of the Omicron in the India. So what is community transmission? We might have heard this term many times in India's news channels. So what is happening now in India? So what is really the community transmission? The SARS-CoV-2 is a virus that spreads from one person to another. We have seen many details about how it is spreading through one person to another person. But the source of the infection thus can be tracked by the retracing the people an infected person meet in the last few days. So this is the method, the standard way of contact tracing as being practiced by the administrations. Till now, what they've done is whoever got infected, they can able to track back by one of the people they got met in the last days, and then they through this chart they were able to track the people who are causing these infections. But now this community transmission is not a new concept, but it is implied in a massive spread of infections where you can't track the source of who from where it got spreaded can be tracked as the virus is a widespread in the community. It is a situation when it is not possible to track who gave the infection to whom, as everybody more or less have the infections. If you have seen a community where almost 90% of people are infected, you can't able to track the who gave the infections to whom. So this is the case which is happening now in India. The prediction says over 10 lakh COVID-19 cases a day in India by Jan end. Maharashtra may see 1.75 lakh infections per day. So one more article which is published in one of the leading newspaper channel in India, it's India Today. It says over 10 lakh cases, fresh cases may be assumed it may be get infected in the end of January. Now we are in the state of 2.41 lakh cases every day. So in the article says over 10 lakh cases may be assumed or will be predicted in the end of the January. So the model offers data on three levels of susceptibility: 30%, 60%, and 100%. Under 30%, the susceptibility rate will be India could see 3 lakh cases per day. The 6 lakh cases per day at the under of 60%. If the assumption is correct and the rate at which it is spreading now, it is going on to the same level. It's going to be 100%, which 10 lakh cases going to be emerged from India and each every day. Maharashtra could be the worst hit because likely to experience over 1,75,000 daily cases in Maharashtra alone, one of the state in India. So this third COVID wave has hit India already. The situation will be worsened in next 2 weeks, is a statement from the health expert. Dr. Shushila Katreya said that the third wave of COVID has already hit India, and so people must not be complacent because that situation will worsen in the next 2 days. According to the health expert, the third COVID wave is not just a flu that will pass away easily. We have seen that the third wave has already hit the country. The number of cases has almost increased 5 times in the last 3 days. So these are the articles which we really need to work on, and then we have people of India have to really see and they have to get aware of what is happening in India. And this so-called lockdown, it's not going to be 100% foolproof because we have seen in last time itself. So one more outbreaking which is causing more and more threat to the health workers itself is 10% of healthcare workers are COVID positive. So only belief people had till now is somewhere this health workers teams are continuously working and then they can able to save us from this somehow through some medicines. But this report says almost 10% of the healthcare workers who are doctors, nurses, and health agents all are tested positive. As rising COVID cases driven by the Omicron batter India, more and more healthcare workers are finding it increasingly difficult to protect themselves from getting it infected. The daily cases surpassing the 2 lakhs on Friday, about 10% of the healthcare workers across the country have tested positive for COVID-19. According to the government source, around 200 doctors across just in India, the capital city, has tested positive. So what is the solution now? So it's a one more statement from the doctor who is already at COVID positive. He said, don't take the Omicron lightly. India has seen exponential rise in the coronavirus over 1 week. less than 10,000 daily cases week ago to over lakhs cases in a day. The country is witnessing an alarming spread of virus. I have served in previous wave as well. He stated that he worked on the healthcare center in the last time also, but this time the doctors itself getting infected. So he said some places entire department itself testing positive. So these are the graphs. We can see how the Delta variant is passing and how this Omicron variant is spreading in 60% more than what is expected. And the Omicron and the Delta graph, where it is 4 to 5 times higher than the Delta variant. So number of cases, like peak cases, which second wave, the Delta variant recorded is 4 lakh. But in the case of Omicron, it is expected to be 16 to 20 lakh per day itself. And people as possible that there won't be a hospitals will be available for treating this amount of peoples. The same way which is happening in all across the globe, the numbers are not true in the graph, in the government exponential charts. You can see the rise, but these numbers are not true as recorded by the government officials. So these are the graph which shows the rise of this Omicron variant all across the globe, where the UAE and Brazil, United States are exponential rise. We can see from 0% in the 1 month before to 80% now rise. And India is in the middle, where facing 60 to 80% of cases rising every day. So these are the official government death toll, which says to 4.25 million. But the excess death reported by the state death register is 3.4 million. But the extrapolation from the estimated infections based on the antibody survey is 4 million. So the expert, it's around 4.9 billion cases have been recorded every day. So another one report from India today, it says 3 billion cases in next 3 months. It is like half of the populations. The Institute of Health Metrics and Evaluation, IHME, an independent global health research center at the University of Washington, has warned the world will see 3 billion Omicron cases in next 3 months. So we really need to look at this as a alarm, for a safety alarm for each one of us. We are expecting an enormous surge in the infections. So an enormous spread of Omicron, say the IHME director, Dr. Chris Murray. Total infection in the US will be forecasted are going from about 40% of the US have been infected so far to having in the next 2 to 3 months 60% of the US getting infected with the Omicron, he added. So one statement we have to understand in this, US itself is claiming it's going to be 60% of population going to be affected by this Omicron. You know, US is the well-developed country. They have more than almost every people have been vaccinated. So this has statement we have to understand very clearly that either it may be get partially or fully vaccinated. This vaccine's not going to help you in this new Omicron variant. So what is the solution now? What is, as Devi has revealed, that only Adi Kailasa and having a sacred bird under the now Pasana Linga is the only solution now. So what is Sri Kailasa offering now as a solution for the sufferings of Pralaya, as Devi has revealed? Let us see a short video where Devi has revealed about that what is the solution for this suffering.
அடுத்த சில மாதங்களில் 1000 அல்ல, லட்சம் அல்ல, கோடியில் உயிர்கள் பலியாகும். இந்திய நாட்டினில் கோடியில் உயிர்கள் பலியாகும். உண்மையை சொல்லுகின்றேன், நன்மையை சொல்லுகின்றேன், தேடிக்கொள்ளுங்கள் உங்கள் வாழ்க்கைக்கு பாதுகாப்பை. ஆதி கைலாசத்தை நிர்வகிக்கும் அன்பர்களே, நன்றாய் கேளுங்கள். 12 ஆண்டுகளுக்கு முன்பாக வரப்போகும் இந்த மாபெரும் பிரளயத்தை தெரிந்து கொண்டு உலகில் இருக்கும் எல்லா ஔஷத சக்திகளையும் ஒன்றாய் திரட்டி நவபாஷாணத்து நிறுத்தி ஆனந்த லிங்கமாய் வைத்திய சரோவரத்தில் ஸ்தாபித்து வைத்தேன். வருகின்ற குரு பூர்ணிமையோடு 12 ஆண்டுகள் அந்த ஞான ரசவாதம் பழுத்து முதிர்ந்து முழுமையான நவபாஷாண லிங்கமாய் மலர்ந்து விடுகின்றது. வருகின்ற குரு பௌர்ணமியில் இருந்து வருகின்ற எல்லோரும் அங்கு வந்து நவபாஷாண தீர்த்தத்தில் தீர்த்தமாடி செல்ல அனுமதியுங்கள். அதற்கு வகை செய்யும் விதத்திலே நல்ல முறையிலே எல்லா நன்மையும் செய்து வையுங்கள். இந்த தீர்த்தத்தில் தீர்த்தமாடியோர்க்கும் அந்த தீர்த்தத்தை அருந்தியோர்க்கும் கொரோனா கொடுந்தொற்று வராது, மரணம் இல்லை, துக்கம் இல்லை. இது அறிவியல் பூர்வமாய் அனுபவ பூர்வமாய் நிரூபிக்கப்படும். அதனால் கோடிக்கணக்கில் மக்கள் வரிசையில் நின்று தினந்தோறும் வந்து நவபாஷாணத்தாலான ஆனந்த லிங்கத்தில் நித்யானந்த லிங்கத்தில் நீராடி வணங்கி நன்மை பெற்றுச் செல்வார்கள். நன்றாய் கேளுங்கள் மக்களே. 12 ஆண்டுகள் முன்பாக பராசக்தி நான் செய்து வைத்த நவபாஷாணம் சித்தித்து புளித்து பழுத்து முதிர்ந்து ரசவாத யோகத்தில் சித்தியாகி இன்று நிறைந்த நவபாஷாண நித்யானந்த லிங்கமாய் வைத்திய சரோவரத்தில் மலர்ந்திருக்கின்றது. இதை செய்த காரணம் வரப்போகும் பிரபஞ்சத்தின் பிரளயத்திலிருந்து மக்களை காத்திடவே. எல்லோரும் கேளுங்கள். ஆதி கைலாசத்து நேரடியாய் மறைமுகமாய் உதவி செய்து உடன் இருந்த எல்லோரும் கேளுங்கள். உங்கள் எல்லோரையும் நம்பியே இந்த படகை நாம் உருவாக்கினோம். இந்த பெரும் சேவையில் எல்லோரும் வந்து பாகமாயிருந்து கொரோனா வராதவர், வந்தவர், வந்து நீங்கியோர் இவர்கள் எல்லோருக்கும் மாபெரும் மருந்து நவபாஷாண நித்யானந்த லிங்கத்து தீர்த்த விருந்து. எல்லோரும் வந்து நல் நீராடி தற்காப்பும் பெற்று நோய் கண்டவர் நோயும் தீர்ந்து நன்மையெல்லாம் அடைந்திட இந்திய நாட்டு மக்களே, உங்களால் இயன்றதை செய்திடுங்கள். உங்கள் எல்லோர்க்கும் நல் பாதுகாப்பும் உண்டு, நல்லதும் உண்டு. என்னை இழந்தாலும் என்னை நீங்கள் மறுத்தாலும் உங்களை நான் காப்பேன். அஞ்சாதீர்கள். பெருங்கருணை பேரருளால் நான் செய்து வைத்த கப்பலை உபயோகித்து இந்த ஆழிப் பிரளயத்தின் பெருங்கூத்து ஊழிக்கூத்திலிருந்து உங்களை காத்துக் கொள்ளுங்கள். உண்மையை சொல்லிவிட்டேன், நன்மையை சொல்லிவிட்டேன். பிராயஷ்சித்தம் வேண்டுமென்றும் காப்பாற்ற வேண்டுமென்றும் கதறிய பக்தர்கள் எல்லோருக்கும் பெருங்கருணையினால் தீர்வை தந்து விட்டேன். அன்பர்களே, பக்தர்களே, சீடர்களே, என் சொல் கேட்கும் நேர்மையான தொண்டர்களே, புயல் என புறப்படுங்கள் ஆதி கைலாசத்திற்கு. தேவையானதெல்லாம் உடனடியாய்ச் செய்து வரப்போகும் மக்களுக்கெல்லாம் அன்னதானம் செய்து அவர்கள் நல்லபடி வைத்திய சரோவரத்தில் தீர்த்தமாடி நவபாஷான மருந்தையே விருந்தாய்க் கொண்டு நோயிலிருந்து தற்காப்பும் பெற்று உயிர்காப்பும் பெற்று நல்லபடியாய் வாழ்ந்திட தேவையான சேவைகளை செய்யுங்கள். இதுதான் உங்கள் எல்லோருக்கும் பிராயஷ்சித்தம். நித்யானந்தன் வடிவு தாங்கி நிஜாவதாரமாய் நான் இந்திய நாட்டில் வந்தபொழுது என்னை வைத்து வாழாத பெருங்குற்றத்திற்கு பிராயஷ்சித்தம் இதுவே உங்களுக்கு. இதை யாவது செய்து, இது ஒன்றையாவது செய்து உங்களையும் காத்துக்கொள்ளுங்கள், நாட்டையும் காத்திடுங்கள். கோடிகளில் உயிர்கள் போகப் போகின்றது என்பதை நேரில் காண்பீர்கள். கண்ட பிறகுதான் நான் சொல்லும் வார்த்தையின் சத்தியமும் உண்மையும் உங்களுக்கு புரியப் போகின்றது. அழிவதற்கு முன்வந்து நவபாஷான மருந்தை விருந்தாய்ப் பெற்று மரணத்திலிருந்து உங்களை காத்துக் கொள்ளுங்கள். மக்களே, இது ஒன்றே வழி. ஓம் ஓம் ஓம். பெருங்கருணை பேரருளால் அன்னை பராசக்தி அருளினேன் சத்தியத்தை. இந்த ஒரு சத்தியத்தை உடனடியாய் புரிந்து கொண்டு உங்களுக்கும் உலகத்துக்கும் நன்மை செய்து கொள்ளுங்கள். ஆதி கைலாசத்து நித்யானந்த லிங்கத்தின் எல்லைக்குள் ஆருக்கும் கொரோனா கொடுந்தொற்று தீண்டாது. இந்த சத்தியத்தை அனுபவபூர்வமாகவும் அறிவியற்பூர்வமாகவும் முழுமையாக நீங்கள் புரிந்து கொள்வீர்கள். இது நிரூபணமாகும். அன்னை பராசக்தி 12 ஆண்டுகளுக்கு முன்பாக உள்ள ஞான ஔஷத சக்திகள் அனைத்தையும் பிரம்மாண்ட யோனி ஹிரண்ய கர்ப்பத்திலிருந்து கொண்டு வந்து உருவாக்கி வைத்த நவபாஷான லிங்கம் இன்று பிரளயத்திலிருந்து காக்கும் பெரும் கப்பலாய் உங்களுக்கு ஊதாவும். என இழந்தாலும் நான் செய்து வைத்த இந்த ரசவாத ஞானத்தின் துணை இழக்காமல் உங்களை நீங்களே காத்துக் கொள்ளுங்கள். இது ஒன்றே வழி. மக்களே, இது ஒன்றே வழி. ஓம் 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 ஓம். Time itself is nothing but your decision to struggle with the same rut. Your decision to struggle with the same rut is time, Kala. Your decision to swallow time is Kalabhairava. Stand. Be a conscious woman or man. Be conscious being. Shrink the time through conscious will persistence. Make the future into present. by being ferocious with yourself. Greater signs of life can be realized with a greater ability to visualize. Greater science is the equivalent word for Hinduism. When you understand the greater science of life, greater courage, more possibility, more fearlessness, more joy, more bliss. When you visualize Paramashiva with 25 heads, 75 eyes, 50 hands, your consciousness becomes ferocious, and that ability to visualize, you will get involved in everything deeply. Involved people are the most delicious, most sweet, most beautiful, most juiciest beings of planet Earth. The moment you decide, your consciousness is the supreme identity you have, you will not empower your depression, your frustration, deal your problems, whether it is simple headache or depression or the worst suicidal patterns or life negativity, only through consciousness. Don't go for any other solution. Don't keep stupid, toxic life negative struggles inside.
Nithyanandam, welcoming back all the viewers and participants watching us live on YouTube, Facebook, and the various social media platforms. We saw about the various revelations which Devi Parashakti had revealed about the pandemic, and will now be moving on to the next segment, which is where how we can reach Devi Parashakti through social media. And let us enter into the segment. The first platform that Devi Parashakti is available to all of us, gracing all of us, is the YouTube platform, where all of us can log on to the official channel of Devi Parashakti, which is Kailasa's HDH Nithyananda, and click on the join icon, where we can join the official channel of the Supreme Pontiff of Hinduism. And once we have joined, you will have access to asking the question in the question section, in the comment section, and you can ask your question to Devi Parashakti about anything that you desire, whether you would like the health, wealth, or relationships, anything that you desire, you can ask to Devi Parashakti. And let us now move on to the next platform.
Nithyanandam. So you can connect with Devi Parashakti through Facebook video. So through Facebook video, the official page for Facebook Live for Devi Parashakti is Kailasa's SPA JGM Nithyananda Paramashivam. So once you reach the Facebook channel, you can click on following icon. So like and follow. So once
the moment you decide your consciousness is the supreme identity you have, you will not empower your depression, your frustration, deal your problems, whether it is simple headache or depression or the worst suicidal patterns or life negativity, only through consciousness. Don't go for any other solution. stupid, toxic, life negative struggles inside. Your consciousness has power at this moment to swallow, digest, clean up all negativity and all toxins. Develop a powerful will persistence. That's the most important asset for life. I am not giving you some life positive blah blah. I am giving you the facts of life. I am triggering your consciousness. I am your Guru. I will make you enlightened. It's my commitment. Till you become Paramashiva, I won't rest. Don't worry at all. To all my disciples, I give you this as a boon. I'll swallow everything with which you are stuck and liberate you all. Time itself is nothing but your decision to struggle with the same rut. Your decision to struggle with the same rut is time, Kala. Your decision to swallow time is Kalabhairava. Stand. Be a conscious woman or man. Be conscious being. Shrink the time through conscious will persistence. Make the future into present by being ferocious with yourself. Your decision to struggle